surpass that and exceed the 15,000 mark. It's a real sign of the planning that's gone into this and the positive way in which all of our officials have gone about their business. And can I really extend my gratitude to those who've put their hand up to get the jab, but of course to those who've made sure that the system is running like clockwork. Pleasingly, as the federal government has announced, the doses of the AstraZeneca vaccine have arrived, and New South Wales will be in a position to start administering the AstraZeneca vaccine from the 10th of March, which is next Wednesday. Pleasingly, we will be administering the AstraZeneca vaccine doses from St George and Hornsby hospitals, and those teams are now being stood up as we speak. And obviously, we are running separate systems. At this stage, we want to keep those hubs that are administering the Pfizer vaccine separate from those hubs administering the AstraZeneca vaccine. But to be clear, there's no doubt that at a point in time in the next few weeks, the volume and supply of the AstraZeneca vaccine will completely roll over the top of the Pfizer in terms of the ability for us to get the vaccine out. I look forward to being able to get the vaccine myself, as I'm sure Dr Chant and Minister Hazzard are, but it's really an opportunity for us to look at how we can scale up that supply, and also make sure that not only are we giving it to those categories outlined in 1A and 1B, the New South Wales government believes strongly that we merge those two categories to get the vaccine out as soon as possible, but also that we offer it to the families of quarantine workers in that first tranche, as well as the families of aircrew. We know there's domestic aircrew which are high risk, and we want to make sure they and their families are vaccinated as well. So in the first phase, New South Wales Government will be combining phases 1A and 1B, and certainly also extending the opportunity to the families of quarantine workers in this first phase, as well as the families of aircrew who are at considerable risk. Pleasingly, there's also been a good rate of compliance of businesses, because as we move forward with the vaccine rollout, we're really conscious that we need people to comply to the existing COVID-safe rules. We are looking to the future. We are looking, as you know, from March 17, easing further restrictions, but we need to have confidence that businesses and patrons are doing the right thing. And pleasingly, we did up the ante on compliance, and there was just one venue which required attention. And the vast majority of businesses and patrons are doing the right thing. And can I please encourage everybody to do that? Whilst testing rates had dipped a bit lower in recent weeks, pleasingly yesterday we had over 17,000 people come forward and get tested, which is a really good sign. It means we're not complacent. We're not letting down our guard just because the vaccine rollout has started. And that's exactly the position we need to be in, because the risk of the virus is still there. The risk of it seeping out of our quarantine system and into the broader community is still there. And we need to make sure we are on top of that. We are also, and Minister Hazzard will outline this, keen to get some information from the Commonwealth on not only the number of doses we're going to get, we've yet to receive that in writing, but also keen to know which of our aged care facilities have received the vaccine, so that we can be ready in case our health system has to deal with any matters relating to that. Pleasingly, we've already stood up those 99 hubs in rural and regional New South Wales, so in due course, when the AstraZeneca vaccine, when the supplies are available, we will continue to roll that out through rural and regional New South Wales as well. On a non-related matter, during or just after the cabinet meeting, I was advised of the ICAC investigation into Mr Sidoti, the member for Drummoyne. I've had a chance very briefly just a few seconds ago to speak to Mr Sidoti. He has offered me his resignation from the ministry. It means that Dr Lee will continue to act in those portfolios until I determine a replacement in the near future. I just wanted to make that comment before I hand over to Dr Chant to provide more details on the health aspects of what I've spoken about. Thank you.
Thank you. So New South Wales recorded no new locally acquired cases of COVID in the 24 hours to 8 p.m. last night, the 45th consecutive day without a locally acquired case. Now, whilst that is pleasing, we do have to recognise that with us receiving international returned travellers, as well as the fact that we have our ports and our airports receiving critical and essential freight, we still remain at risk of an incursion event, so the introduction of COVID into the community. So it is critical that we continue to practice those COVID-safe behaviours It is pleasing to see the speed and pace of the rollout of the program, and I want to extend my appreciation to all those involved in that enormous logistic exercise, as well as those who have rolled up their arms for the vaccine. The focus on quarantine workers and border workers particularly assists us in ensuring that we ring-fence and further decrease that risk of incursion events triggering the need for broader community action associated with local community transmission. It's been pleasing also to see the testing numbers increase. We've had 17,047 tests in the last 24-hour period. And again, thank you very much for all of those people that have come forward for testing. It is going to be part of what we need to continue to do, even in the presence of vaccine. Clearly, throughout 2021, we're going to need to calibrate and change our public health response as we progressively get the community vaccinated. But at this point, please continue to get tested, even with those most minimal of symptoms. Thank you.
Thanks very much, Kerry. Well, I'd also just like to thank the incredible health staff at the Frontline at Royal Prince Alfred Hospital, Hub, Westmead and also Liverpool. There's an incredible energy and buzz at each of these hubs as the frontline quarantine staff and health staff are coming in for their vaccinations. And I can assure the community that the medical community is very keen to get their vaccinations, and so the broader community should also be, in due course, very keen to get their vaccinations. I think I've said before that we have roughly about 6,500 staff in any 1 week looking after our quarantine systems, our quarantine hotels and our health hotels. Pleasingly, only a week and a half into our rollout of the Pfizer vaccine, we've already vaccinated 4,200 of that 6,500. So to have achieved that, 2/3 of our frontline quarantine staff is certainly addressing the issues that Dr. Chant has regularly talked about and just spoke about again, and that is making sure that our frontline staff have the vaccination to make sure that we effectively ring-fence the people who are coming in from overseas, who unfortunately are all too frequently carrying the virus or a variant of the virus. I have no doubt that the federal government will, in due course, give us the information that we need, as the Premier said, to continue our planning for the rollout across the state. But we are looking forward to getting information from the federal government as to the precise numbers of people who have thus far been vaccinated in our aged care facilities. And indeed, we're looking forward to understanding which of the aged care facilities have actually had their teams in there vaccinating the residents. As we understand it, they're not vaccinating at the moment, even the ones that have attended, the staff in those facilities. So we're looking forward to seeing from them a program going forward of how many of those staff will be actually vaccinated, when they'll be vaccinated, so that we can factor that into our overall New South Wales health response to make sure that we roll out the vaccine to our entire eligible 6 million people across New South Wales. Finally, the information in relation to the ADF, clearly that was not something that I as Health Minister was aware of, but I look forward to receiving that information in due course from the federal government. Thank you.
Well, good morning, everyone. You can't beat a pandemic with paper, and in New South Wales we've proven that digital has been a core component of our response. We've hit a milestone recently with over 4 million people downloading the Service New South Wales app, which enables check-in features right across the state in hospitality and high-risk venues. We've had about 118 million check-ins right across the state, which is just an extraordinary effort by the people of New South Wales. And we've had people giving us feedback over 4 million times with an extraordinary 95% thumbs up. So the digital framework that we have built here in New South Wales is really strong and getting stronger. And what this means is that in the future, we can use this same digital framework to respond to future challenges, whether it's floods, fires, droughts. we're building resilience now through the Service New South Wales app to further protect the people of our state moving forward. And I just want to thank all the businesses that have downloaded the app and that have been compliant. I want to thank every person that has gone out of their way, done the right thing by checking in. Again, every time somebody checks in, they are building strength and resilience and protecting people and keeping businesses open. You know, if COVID was a 400-metre race, we've definitely turned the corner, and we are definitely in the home straight, but we are still in the race. Now's not the time to lose focus. Now's not the time to forget to check in. Now's the time to remain focused on the challenges ahead, because if we stay the course, we'll get through this. And I just again want to thank the people of New South Wales for showing how strong, forward-leaning they are, how innovative they are, and how quick they are to adopt technology, because that has really stood us apart from the other states, not just here in Australia, but indeed around the world.
Mr. Dominello, second time in a week you've made very public criticisms of the federal government here on the lack of information coming through. This sounds like it's becoming a real problem for your government.
Oh, look, we're one team as far as I'm concerned, but to be one team we just need to make sure we're sharing information when it's available with each other. And it would help us enormously if we knew which aged care facilities had received the vaccine. It would really assist us just in terms of our own planning projections, and also whether the staff at those aged care facilities had received the vaccine. What we're trying to do in combining, as far as the public is concerned, and if I wasn't the Premier I wouldn't know the difference between 1A and 1B, but as far as New South Wales is concerned, we're combining those two phases to make sure that if we go into a residence, or if we go into if we invite anybody to come and get the vaccine, we're getting all the cohorts at once rather than having to go back twice. So it's really important for us just to be able to share that information. And of course what we're doing in New South Wales is making sure that the first people who are offered the vaccine, and that's been the case in the first 15,000 that have already received the jab, that we're really focusing on those at most high risk of both receiving it and then spreading it, because when you reduce the risk of community transmission, it does allow you to think about what you can free up in the future, how we can protect the community. So obviously that's why we've included in the first phase the families of quarantine workers as well as the families of flight crew, because we know they're very high risk individuals in terms of potentially getting the virus or spreading the virus. I just think sharing of information is, I was really heartened to hear yesterday when Minister Hunt spoke about, I think, the 13,500 people who the federal government had vaccinated in the first week. It'd be really good to know how many of those are in New South Wales and where they are. And that's all we're asking for, just to share the information and when it's available. And we've been doing that daily. Our health officials provide daily update to the Commonwealth on who we vaccinate and where we vaccinate them. And again, we're a strong team, and I want to commend the federal government for the supply of the vaccine. I mean, the numbers we're hearing about AstraZeneca potentially arriving on our doorstep are very positive, and that's why in New South Wales we're really keen to get our systems up and running. Our booking system is online. The way that we deal with the patients or the people getting the vaccination when they turn up is smooth and seamless, and we've planned it so that we can scale it up. And I think what we've also demonstrated is we do have an eye to the future. I want to commend Minister Dominello and Service New South Wales to have about 75 to 80% of the adult population on the Service New South Wales app. Gives us enormous opportunities in the future about making sure people have information on that app, potentially about whether they've received the vaccine, and potentially about making life easier for them in the future. So we are doing everything we can to plan for the future, and information sharing is key to that. And both the Minister, Minister Hazzard and myself will continue to state that. And we appreciate it's also very complex to be able to collate and share the data when you're rolling out a vaccine across Australia. I've only got to worry about New South Wales, and clearly the federal government is doing that important work across the nation. Again, I want to commend them for the number of doses they've been able to get out the door in the first week, but it would be really helpful for us if we knew which facilities had received the vaccine and whether staff in those facilities had received the vaccine.
When you requested that information, what's happened?
Look, I might ask Minister Hazzard, who's had more detailed conversations with Minister Hunt. I've had conversations with Minister Hunt as well, and obviously we have National Cabinet on Friday where I'll raise these issues, but I will ask Minister Hazzard to make some further comment about the conversations he and his colleagues have had.
Thank you, Premier. I think it's fair to say that the rollout of vaccines in a 100-year pandemic is extremely complex. And of course the federal government have been very active in obtaining those vaccines in very trying times. So the vaccines having come to our shore, they are now obviously working with states and territories, and we are trying to work with them to roll out those vaccines as expeditiously as possible. But it is necessary for us to be able to do that, to have full exchange of information, full transparency, and we've expressed that, I've expressed that to Minister Hunt and to the federal government quite clearly. It's a matter for other ministers to comment on that around the country, but there have been other ministers who I understand, I know, have indicated similar issues to the federal government, to Minister Hunt.
Minister, what sort of pressure is that putting on?
Hang on, guys, I'll just finish, please. Just whoa. Also, in relation to the ADF issue, as I've said previously, it would be really helpful if we were now given a letter of confirmation of what was apparently given to the media yesterday, and a plan and a schedule to understand exactly how the ADF are going to work in New South Wales, so that as our health teams, who are world-class, can then proceed to establish what their role is in determining how we move forward. Sorry, you were going to say.
Minister, you still have nothing in writing from Canberra confirming that the ADF are helping with this rollout?
I have nothing.
And Minister, what sort of pressure is that putting on, say, aged care facilities who are perhaps preparing for the vaccine to come and waiting?
Look, these are issues which obviously are logistical issues that have caused a degree of grief, genuine grief, in aged care facilities across New South Wales. Certainly I've been getting reports of folks who are sitting there waiting for their vaccine. And to aged care residents and those who are older in the community, those who have other health issues, have been stressed beyond belief in the last 12 months. It would be helpful if there was clarity and certainty and actual delivery on that prospect, so that they don't have their grief and anguish added to. So I think there's a lot of work to be done on that front.
Minister, how are you deciding in New South Wales who gets Pfizer, who gets AstraZeneca? Is there a distinction, or is it just trying to get these first two groups done as quickly as possible?
At the moment, the original plan off 1A and 1B was to move forward with Pfizer, obviously, principally. But now that the federal government have been so successful in getting the AstraZeneca into Australia, the expectation is that the AstraZeneca will be able to be used to assist us in those early groups. But again, we literally are just receiving that information. We need to have more detail on precisely when the various doses are going to arrive here, so that we can have our health teams work on how that will be delivered. But it's principally the same groups. It's obviously at the moment, our quarantine workers, our frontline health workers, but as the Premier said, we're also rolling out into other areas, particularly the two new hubs that you just referred to, and the other ones that we referred to last week in regard to the regional areas, Wollongong and Newcastle. So the expectation is that AstraZeneca, the use of AstraZeneca, will be making it easier in a sense, because clearly it doesn't have the same refrigeration problems or challenges. So we would expect if we get more AstraZeneca and we have a clear line of sight on precisely when and where it's going to be available, that we would be very happy to accept that and move forward with those groups.
Premier, have you had any conversation?
The federal minister yesterday said...
Me or... Sorry, yeah.
The federal health minister yesterday said that as part of 1B, the over 80s are included. So does that mean from Wednesday, think when that age group may have access?
Do you want to answer that one?
Yeah.
Well, perhaps Dr. Chant might answer that.
So at this point, our focus is on using that initial supply to do the quarantine, to complete some of the healthcare workers and also the families of quarantine workers, and make sure we've got that ring first. We'll then also be looking at what are the opportunities where we intersect with other particular cohorts, but we suspect that the Commonwealth, through its GP program, will be targeting very much those over 80s, and so we are trying to role delineate and pick the areas where we can add logistic efficiency, and those where it's best delivered in a primary care setting. So that's the clarity we're going. But obviously we're happy to be responsive as the situation changes, but we really appreciate the fact that AstraZeneca does look like we're going to have quite strong supplies of AstraZeneca, and I think that's a very positive note for the community.
Dr. Chant, can you advise
Just on the aircrew situation, either one gets one. Just what's the thought process behind that?
So we have, so we have international aircrew is our issue. So we have a number of international aircrew who reside in usually the fringes of Sydney. They fly for a variety of different companies. We obviously have a testing regime, but we also allow them to self-isolate. They've basically been in perpetual self-isolation for many months, many of them. And obviously they are a priority, just like we would for our border staff. So people going overseas and being exposed overseas are clearly a priority. So we would be vaccinating them, and we'd also be vaccinating the households, just as we would be quarantining workers, on the basis that although we've got daily salivary testing, we've got good, strong infection prevention and control procedures in our quarantine facilities, we know that even just a minor lapse can sometimes lead to transmission. And then the group that's most likely to be then infected is the household members. So because that's the way the virus will get in, we're trying to use the vaccine early on to really ring fence and protect us, which will give us time to then roll out progressively the vaccine using the existing mechanisms we have. Our general practice community is a strong one, and many people are familiar with accessing vaccination.
How many aircrew and their families? Is that lots of people in New South Wales?
No, it's not lots of people, but again, we're working through. It's a small number, but clearly we want to protect those people that are exposed internationally. That's the fundamental issue. Anyone who could be bringing COVID to our shores are the groups that we want to make sure are absolutely protected. So our ABF colleagues, our cleaners at the airport, anyone who is present where there may be that inadvertent interface, even with the best controls we have in place, we want to protect from inadvertently getting it. And we know that the disease can sometimes be incredibly mild. And so, again, this is a precautionary approach to try and protect us against those incursions. And we have seen the history has written that this is the way the virus gets into the community.
And will those aircrew still have to face perpetual isolation
yes,
once they're being vaccinated?
Yes, at the moment, vaccination status does not change any of your quarantine or isolation requirements. Obviously, over time, and as we vaccinate more of the community at every time, and I think I've indicated this, 2021 is going to be a time when we actually pause at various points in the year and say, how can we calibrate our public health controls so that they're proportionate to the threat that COVID presents at that particular point in time. And at all times, we're going to have to think about how are the variants of the virus variants overseas. What are they covered by the vaccine? How are they becoming the predominant strains? What does that mean? As well as looking at the effectiveness of vaccine rollouts at scale in other international countries where there's lots of disease, to actually see how it impacts on transmission and what it then does to the severity of the disease and how it's transmitted in the community. Those learnings we will benefit from, and we'll have to incorporate that in our public health response. So 2021 is actually going to be just as challenging as 2020 when we continue to learn about how we calibrate our response to COVID.
Premier, on the COVID passport situation in regards to the Service New South Wales app, that'll be a scheme by which the vaccine can be incentivised to people in New South Wales. This lack of information from the federal government about who's getting the vaccine in aged care facilities, is that putting the COVID passport system at risk?
No, it's not putting it at risk. I suspect there's a lag in terms of being able to collate the information and get it to us, and we accept that. But what we are doing is planning for the future. So we're trying to be a few steps ahead so that New South Wales and Australia don't fall behind the rest of the world when it comes to opening up. And that's really, really important. What we have to appreciate is Australia as a nation has done an outstanding job in managing the virus, but we also have to accept that our borders, our international borders, have been closed during this time. The rest of the world is getting the vaccine rolled out and their borders are open. And so we don't want to run the risk of being left behind, and that's why we're preparing our population. We're preparing what we can do here in New South Wales to really provide those opportunities for our citizens, whether it's international travel, whether it's moving around more freely without restrictions. These are all things we're looking forward to, but as Dr. Chant said, that does bring a degree of complexity in our settings, and that's why information sharing is key. And I appreciate the federal government's job is far more complex in having to roll out the vaccine nationally. Ours is just New South Wales, and the only point we make is the data sharing is really important for us moving forward, and we're willing to come to the table as we have been to make sure we get that data sharing where it needs to be. But I
suspect having two apps,
I'm sorry.
A national app, a state app, don't run the risk of duplication here. Aren't people going to get confused? It's better that the federal government hold the information who's been vaccinated because they have access to the National Immunisation Register. You guys don't.
No, look, I'm completely comfortable with that. All we're doing in New South Wales is preparing ourselves for things that our state might be able to offer our citizens. Other states might be slower to the scene, and we don't want our citizens to be held back. So we're just preparing ourselves for the opportunities that might come for our citizens. Yes, the Commonwealth does have access to the information, to the body that you said, Chris, which I forgot the name of. Thank you. Yep. But they share that information with us, and Dr. Chance explained that to me on a number of occasions where the Commonwealth does share that information with us. And look, I'm all supportive of a national scheme to give people that passport if that's the case. But if we're able to enhance what's offered or enhance what's available or provide more timely opportunities for our citizens, we're just saying that we're ready and willing to do that, because we don't want New South Wales to fall behind. And I believe a strong New South Wales is a strong Australia, and we're looking forward to the opportunities we have. So there's no doubt all of us still have to be on guard as far as COVID's concerned, but I do want our citizens in New South Wales to start thinking optimistically about the opportunities that might come down the track once the vast majority of our population has been vaccinated, and that's the key. We can't move forward to thinking about those opportunities, thinking about the things we've been denied for the last 12 months, just over 12 months, unless the vast majority of our population is vaccinated. And that's why we're always open to considering incentives that our state might offer, which other states may choose not to offer, because we have had a bit of a different pathway to dealing with COVID than other states. Every state, that's the prerogative of their premiers, but we've tried to have an open economy as much as possible. We've tried to keep things as open as possible, and we've tried to not burden our citizens unless we've absolutely had to when it comes to restrictions. And I just want to make sure, and I want to commend again Minister Dominello and Service New South Wales, to have 75 to 80% penetration of an adult population with one app without really trying very hard has been outstanding. And I just want to thank the people of New South Wales for respecting our advice, and the fact that 117 million times people have tapped into QR codes shows that we are building resilience. We are a state that's providing a COVID-safe environment so that we can consider those settings moving forward, and we can look forward to being able to resume those activities that we'd been denied since the pandemic started.
Premier, have you had any discussions at any point during this pandemic of the Defence Force being involved in the federal government's Phase 1A rollout to aged care facilities? And do you think the Defence Force is needed in aged care homes?
I only found out yesterday. I think Minister Hazzard was in my office when we found out together, so I had no prior knowledge to that. And look, I'd just ask you to ask the Commonwealth about what arrangements they have in place. Given the distribution of the vaccine in aged care residences, and I shouldn't use the word facilities, but residences is the responsibility of the Commonwealth Government. So it's for them to explain to us why they think that's needed. All I know is that as far as New South Wales is concerned, we are gearing up our opportunity. And I think I said a few weeks ago rather confidently and perhaps rather too assertively that if there's opportunities for us to bring forward the vaccine rollout in New South Wales, we'll do that. And we're really keen to do that, because which is why we're getting our systems in place. I'm proud of the fact that there's an online system. People who've had the vaccine talk about how seamless the process has been. We have an observation team at the end. We're following up. Health is actually following up people and asking them questions so that we can assess what the response has been and what any symptoms or side effects have been. And to date, it's been very positive. And we're trying to look at opportunities where we can bring it forward as soon as possible, because, as I said, the sooner the vast majority of our citizens get the vaccine, the sooner we'll be able to ease things further, look at opportunities we've been denied, and really create our path forward. And I don't want to be slowed down. I want us to actually have the opportunity to bring things forward. And what's been heartening for me, and I want to thank the Commonwealth Government for the supply of AstraZeneca. It'll soon be manufactured here through CSL on Australian soil, which is great. And the challenge for us, it seems, in the coming months won't just be supply. Supply seems assured of AstraZeneca, but it will be distribution. And that's why we're looking forward to the GP network coming online, as Dr. Chant said, and which health experts said, for some vulnerable cohorts or groups of people, the recommendation might be you should go through your GP network. And for other groups of people, we might say, there are opportunities for you to use the existing hubs we'd initially set up for staff and for quarantine workers. There is opportunities for us to extend the use of those for individuals, and that means we can bring the timetable forward. That's why it's really important for us to understand who has been vaccinated in New South Wales in areas that we don't have responsibility for, whether those aged care workers have been vaccinated, because that gives us opportunity then to bring forward the invitation we'll be offering sections of the community to come and get the vaccine. And for us, it's all about maximising those opportunities. We don't want to see vials of doses sitting there without being distributed, and that's why we're just hoping to be able to move as quickly as we can, because having a vast majority of the population vaccinated means we can look forward to a more positive way of living with COVID.
The federal government has just delayed the opening of international borders to the middle of the year. How is this hurting our chances of getting international students back into New South Wales and allowing us to
well, I think, I think we should look at it from the reverse perspective. To have the concept of having international borders potentially open from June, I think is a very positive thing to look forward to. I mean, we're March already. Time is marching on, literally. So I think that's something for us to look forward to, but we have to also acknowledge the risks. And once you open up the concept of international travel and international borders, we also have to accept that we're part of a global community, and that exposes us to nations who may not have the vaccine, nations who have higher infection rates. So that does open as many questions as it does answers, and that's why we know that we will, as a government, have the freedom to make those decisions when we're confident that more and more people have been vaccinated. That gives us the freedom to move forward. But again, can I say, generally speaking and positively speaking, the federal government should be commended for the supply of the vaccine, should be commended for getting it to the states. We're as keen as mustard to keep distributing that, but we're also keen to know that once the GP network is rolled out, as the Commonwealth has responsibility for, and people are invited to go and get the vaccine, we are also suggesting that post this initial phase, we want to continue standing up the hubs we've established to allow some groups of individuals to come, so we can accelerate the vaccine rollout and get as much of our population as possible vaccinated as early as possible.
Sorry, Premier, on John Sidoti, can I just clarify, he's resigned from Cabinet, but he's going to stay as a government MP, and if that's so, why is that acceptable to you?
Well, look, to be honest, I've not even seen the terms of reference. I've just been advised there are public hearings set at the end of the month. I spoke to him briefly before this press conference. He offered his resignation from the ministry, which I accepted, and on that basis I will be appointing a new minister in the near future, and in the interim Dr Lee will continue to act in his role.
Why not suggest going to the crossbench and not being a government MP anymore?
Well, obviously we will look at the terms of reference, and the matter is under investigation at this stage. That's all that he's been required to do.
If he can't be a minister, why are you still
allowing him to be a member of your parliamentary team?
Look, I've yet to see the terms of reference. I've yet to see what matters.
Resignation as a minister?
Correct.
Why won't you kick him out of your parliamentary team? He's not good enough to be a minister.
Because there's a due process that needs to be followed, and I have to seek advice on what the matters are that are being investigated.
Quickly on the COVID vaccine rollout again, is one of the issues you're worried about with the aged care data sharing, is it potentially doubling up on people who've already had the vaccine? You know, they might be affected by dementia or mental issues.
Oh, I think it's important for us to note, especially as the rollout continues in rural and regional New South Wales, the extent to which aged care workers are vaccinated as well. Clearly in Western and Southwestern Sydney, where there's the higher risk, we want to make sure that we have an understanding of which categories of people have been vaccinated, so that we can work our way through the processes here in New South Wales. But what's really important is to make sure that we are able to scale up, and it's really one team. It's the Commonwealth and the state working together to get the vaccine rolled out to as many people as possible, as quickly as possible. And obviously we don't want to double up. We also want to consider the opportunities to reduce the risk in those high-risk areas. As you appreciate, in New South Wales, we successfully argued the case that we wanted the first people to receive the virus, can I say that again? The first people to receive the vaccine to be those most at risk of getting the virus or transmitting it to others, and that's why quarantine workers and frontline health workers, frontline people exposed to COVID doing the tests have been our priority. But obviously, as you go down the risk profile, you then consider other areas of risk. And we know that if the virus did get out into the community, that obviously our aged, our vulnerable, our immunosuppressed populations are the most vulnerable. And it's important for us to have an appreciation of who's been vaccinated, especially in particular once there's a greater rollout in rural and regional New South Wales. It would be easy to go into one town and do everybody as opposed to going.
Another corruption inquiry looming. How is this hurting your government and the ethical foundations of your government?
Well, look, I would say that the New South Wales government is providing those things that matter to our community: strong leadership, strong services, good quality of life, and we'll continue to do that.
Did you ask John to for his resignation?
I'm sorry, you haven't answered the question.
After revelations of last year and now, which is still ongoing, and now this, I mean, how can the people of New South Wales be assured that your government is working in their best intention?
Oh, I think the people of New South Wales can be assured, and I think we've demonstrated that in the past 12 to 18 months in particular, that we're here first and foremost for them. And every day, every waking day is about how can we protect our community and how can we enhance their quality of life. Sorry, last question, sorry.
Last one question of Mr. Hazzard, if that's okay. The Premier's talking about scaling up the rollout, getting it out as quickly as possible. Why are there limitations on the number of GPs who can administer the vaccine? My understanding is the federal government's only got a certain number of GPs they're going to give the OK to. Why can't everyone just go to their own GP?
Look, I think initially the federal government was making decisions around the Pfizer vaccine as the primary vaccine. That was the one they were fairly certain of getting. I must say, as Health Minister, my view is that we should be doing everything possible to roll out what now appears to be available in vast quantities, and that is AstraZeneca. And we have a very good a very good primary healthcare system. That is GPs. I think there are 8,000 GPs across New South Wales. So I would be hopeful that we might revisit that question actually in the next few weeks and work with our federal colleagues to see whether there's some opportunities to broaden out the vaccination program so that we all can choose our own GP rather than having to go to another GP that might have been endorsed through this earlier process. But look, these are things that now that the federal government has been so successful in getting the AstraZeneca, it does change some of these perspectives. We have, in a normal year, flu vaccines and other vaccines are delivered through our 8,000 GPs across the state. That obviously would be a massive increase in the soldiers at the front line, or perhaps should refer to soldiers in the current ADF issue, but have more GPs on the front line doing what they do so well. And I mean, there are also some issues that we need to have a chat about. Obviously, there would have to be some consideration to what training program might be available for GPs, for example, to deal with the multi-dose vials that are both applicable to AstraZeneca and Pfizer, and we may even have other vaccines in due course. But it does seem that it's a timely issue for us to be thinking about that now, and certainly in New South Wales there have been experiences, I think, was it MERS or what was it? Swine flu, that's right, the swine flu, thank you. When swine flu was an issue for us, our GPs at the front line, our own friendly local GP was the one that we went and got the vaccine from if we needed it. So I think there's some opportunities that all of the governments need to be thinking about at the moment. But at the moment, we've only just received this information from the federal government, so we haven't had a chance to have that that discussion with them. But I'd be hopeful that they might be thinking about that, and certainly our government is thinking about that.
Great, thanks everybody.
Thanks, guys.
Thank you.
Thank you very much, everybody.